Greetings and welcome to Tools and Resources for Research-Practice Partnership. I am Kim Dumont, Senior Program Officer at the William T. Grant Foundation, and I'm joined today by Suzanne Barnard from the Annie E. Casey Foundation. I will serve as your moderator for today's webinar. Today we're featuring our fourth and final webinar in the Leading with Evidence series. The Annie E. Casey Foundation and the William T. Grant Foundation are in the third year of a partnership co-sponsoring the Leading with Evidence series of convenings and webinars. Our overarching aim is to offer practitioners ideas that can immediately apply to their programs and practices, and to help researchers gain more clarity on how to strengthen the utility and relevance of their work. Ultimately, it's our hope that all participants support the acceleration and use of research evidence to improve outcomes for the populations you intend to impact. Today's webinar describes how research practice partnerships can support child welfare agencies' efforts to serve children and families in efficient and effective ways. Research practice partnerships are long-term, mutually beneficial collaborations that promote the production of research, and its use is always focused on problems of practice. These partnerships can serve as a valuable resource as your agencies work to respond to family first, especially with the emphasis on prevention and the use of evidence-based treatment models. We have invited two agencies to share their stories. Scott Burdick from Orange County will describe his agency's long-standing partnerships with its researchers within their own organization. And Andrew White and Kristin Barnard will then offer a view and story about their partnership between the New York City Administration of Children's Services and SUNY Stony Brook and their efforts to both use and improve evidence-based programs. Before we begin the presentation, I want to take a moment to go over some important housekeeping details for the webinar. After we hear from our presenters, we'll have some time for questions. Because we have so many of you with us today, we'll want to keep our attendees on mute throughout the webinar. We ask that you submit your questions by entering them in the Q&A window, which you see circled on the slide. You'll find that window at the lower right-hand corner of your webinar screen and can submit a question there to panelists. If you're in full screen mode and want to ask a question, you may need to return to the event window by using the drop-down controls at the top of your screen. I will also mention that this presentation is being recorded, and the recording and the slides will be available later at aecf.org. And with that, I will turn the program over to Scott Burdick to get things started. Scott?
Good morning, everyone. I'm Scott Burdick. I am a Deputy Director at Orange County Children and Family Services, and am here to talk to you today about many of the lessons that we have learned in Orange County with our partnerships that we have in data. So let me begin by talking a little bit about Orange County to give you some context. So in Orange County, we are a population of about 3.2 million, about 705,000 of which are children, which makes us the third most populous county in California, but the sixth most populous county in the United States, and more populous in 21 United States. So that being said, our child welfare system, on the next slide you can see that we have about 3,600 children in care. About 2,250 of them are in out-of-home care, and 1,000 of which are in-home, and about 350 non-minor dependents. So as looking at social work and data, I think it's important to note that the perspective that I come with is not as much of a researcher initially, but was from that social worker perspective about how we can make a difference. And obviously, if we're looking to make a difference, it's important that we're not having that definition of insanity, right? Doing that same thing again and again and searching for a different result. So for us, we need to make sure that we're finding ways of going a little bit further tomorrow than we did today, and that requires change, which is usually not comfortable. And that being said, change for the sake of change is not good. It needs to be strategic. And in order for us to be strategic, we need to make sure that we have a good evaluation. So one of the first lessons to talk about is one of the first lessons I got when I became a brand new supervisor. And I remember sitting down with my manager at the time, and he said, Scott, what gets watched gets done. And so I think it's important, and this is one of the slides that I show more than any other slide, because it takes our outcomes over the years from the late 90s to the present time. And what you'll see by the gray line is it looking at our dependence of the court, and the red line is looking at our children in out-of-home care, and this is the average monthly number. And I remember the first time I created this slide a few years back in meeting with my director, and I had that really positive, overarching, optimistic view about look how great we've come now, and look how successful we've been. And his viewpoint on the reverse end was it looks like we're stagnating a bit, which I thought was kind of an interesting perspective, and it was accurate as well. So we have all these different things, and you'll see on the next slide all these different initiatives. So that what you can't see is each of those little bubbles are the initiatives that we have implemented over time. And the red line you see is that overlay from the previous slide as well. And so you see these are our outcomes, but it becomes so critical, and we have so much that's going on that we are making sure that we are truly effective and we're evaluating all of these different initiatives that we're doing to really look at its efficacy. So one of the things that's been important for us, and you'll see on the next slide, is looking at our regular outcome tracking. And so this is something we call our balanced scorecard. And it's something that we use on a regular basis to track our safety, permanency, and well-being outcomes. So this is only one example here. But you'll notice the simplicity of it, which I think brings great value, is if we're doing well, we get a green arrow. If we're doing poorly, we get a red arrow. And if we're kind of middle of the road, we get a yellow line. And it tracks our different performance measures, looking at our last fiscal year, looking at our goal, and then looking at each of the quarter outcomes. And then what becomes important is it then looks at the strategies that are contributing to this. And so when we work closely with our research team, it's become very valuable for us to be able to have that constant evaluation of where we are on the different initiatives. So the second lesson that we learn is that collaboration is key. Right? You need to have the agency. And when we try to do everything ourselves, it became a huge problem because we're not the experts in anything. And actually, it's funny, I recount a story of when my 17-year-old was in high school, and she's texting me from a psychology class, and she says, Dad, in your over 20 years with the agency, if you could attribute one thing to the success that we had, what would it be? And it was very easy, surprisingly, that is about these collaborations that we've had and letting the community do what the community does, and us to be able to support them in the way that we can, and we all want the same outcomes. So if you look at the next slide here, what we did in 2003 is we brought in the family-to-family initiative, and one of the key components of this became our self-evaluation team. And so in its current incarnation, we have our Children and Family Services Deputy Director, which is me, and we have our research manager and our reports team manager that lead this group. And we have multiple members of this group, including our DART team, our data analysis and reporting team, our research team. We have program line staff, so we're making sure that we're including those that are doing the work and finding pieces that are meaningful to them. Our policy staff, so we're incorporating this in our policies as well. And a real important component of this has been our community partners. Because again, if we're looking to trust them on the things that they do well to support the same families that we're serving, it becomes a critical element that the data that we're being able to present is valuable to them as well. And then a more recent addition has been our strategic communication group. So now we're marketing this as well to the different groups in a way that resonates with them and makes the greatest sense. So let me speak a moment about our internal structure. So I talked about our self-evaluation team, but one of the important lessons that we also learned is that when you put a lot of data and research people in the room together, it gets very technical. And pretty soon we started to find that a lot of those community partners and practitioners we were bringing to the table were whittling away. And so then we created our technical subcommittee that meets separate of that group. That allows us to then be able to work out a lot of those technical details and then report them back to that self-evaluation team. So that's been a very valuable piece to keep that SET team strong. And so I talked about our DART team, and just to give you an idea of how many members of that in our research team. We also have our FACT network, which is our family resource centers, which is 15 throughout the county. And we have a data team of 2 members that also contribute to data that goes back to our SET team as well. Another important part that we've had is what we call our CW SIP, or our Child Welfare System Improvement Partnership. And that is designed to have executives from all over the county, both internal and external, so that we can look to drive what system changes we need to make to continue to improve our outcome. And then also we have regular deputy director and director meetings that our data teams are part of, so we're making directional decisions that are part of that group. But very simply, you'll see that this is really articulating how our research and data teams need to be immersed in our process for us to be successful both in our planning and in our evaluation. So very quickly, let me just show you about our internal structure so you can kind of get an idea how we operate. So our social services agency, we have a director at the top and then a chief deputy director and then 4 divisions. And so you'll note that in our admin division is where our research and our reports team report, but they also work with our family self-sufficiency, our adult services, assistance programs, and our children and family services. And so you'll see on our next slide why that becomes so important and valuable is that allows us to be able to fund them. So with the 4 divisions, there's administrative costs that go with every position, and part of those administrative costs are the reporting out piece so we can report to the state. So because we have those requirements, that allows us to have that justification for these positions. And when you're looking at administrative costs for over 4,350 staff, you see that allows us to be able to blend these multiple funding streams when staff are time studying. And as you see from that graph below, it tells us that about 62% of the funding comes from state on the research team and 31% from federal with a small county match. And it's on the reverse side for the reports team that it is more federal funded than it is state funded, and a little bit more of a county match on that piece as well. So the next lesson to talk about is allowing our research and data team to do what they need to do. And one of my favorite data quotes is, if you're looking at everything, you're looking at nothing. And so one of the things, because we have this team, it becomes this whole, everyone starts sending all these requests and all these other things to the team, and it starts inundating them, so we can't get them to do what we need them to do. And we found that over time, that certain reports that had value in a particular moment no longer hold that same value, but we've continued to do it just because that's what we've done. And so that's become an important piece to make sure that we're evaluating what they need to give us. Also, we have different partners that are now providing reports, including the National Council on Crime and Delinquency that gives us Safe Measures. And Safe Measures has over 290 reports, but people like to see the reports and they like to get them versus having to go and create them themselves, which again taxes our data team so we can't get what we really need out of them. And many times we find with some of these reports that with just some small adjustments, either with working with our partnership or for them learning how to extrapolate certain information, that they can get the information that they need, and it doesn't require our data team to do that. Another piece that we have done is we realized that there are so many public-facing resources when community partners want information. Again, instead of taxing our data teams on that, it allows us to be able to forward them a link, and then they have that information on a regular basis. And one of the links that we're going to, I think, will be included from this particular presentation, we're in the process of posting that to a website, and it's actually a 2-page document with some very valuable public-facing information. So the final lesson I'm going to talk about in my time this morning or afternoon, wherever you're located, is that data allows us to really leverage our partnerships. And so I'm going to give a couple different examples here. The first of which is what we call neighbor to neighbor. And neighbor to neighbor is our differential response path 1 for calls that do not rise to a statutory threshold for a response, but we want to preventatively serve them, particularly when we learn that about 2/3 of all of these hotline calls were made on families where there had been a previous call. So we did it with a big budget of $0, and we were able to serve thousands of families preventatively by making it a win-win. And the win-win was that the community organizations could provide much-needed services for these families before they crossed that threshold of abuse and neglect, and we could provide them with data so they can now go back to their funders to receive additional funding and keep these things going. So on the next slide, you see we've been able to leverage this with some work we've done with the faith community and with our family resource centers, and we're currently in the middle of a pilot with 3 of the family resource centers that we're taking calls in a preventative fashion, moving them out to the family resource centers, using our faith partners to create incentives, whether it be gift cards or food bags or those things to bring people into the family resource centers. And now we've seen about a 10% engagement rate of these families. And so as you see from the measures here about the evaluation, that we're looking to see how we can evaluate those things to make sure that it's making a positive impact. Now, on the next slide, we've also been able to use some of these partnerships for those that do reach a statutory threshold. And so we're in the midst of what we call an emergency response warm handoff pilot. And these are for cases that are deemed high and very high risk, that we have substantiated allegations, but we've been able to mitigate the safety threats and close the referral. And so when we do this warm handoff to the family resource centers, it's really predicated on some information that I'm going to spend a couple minutes going through so you can kind of see the thought process behind this and the critical connection that we have with our research team with starting this. So the first, on the next slide, you'll see is our 2013 California risk validation results, which comes from the Children's Research Center. And this here very clearly you can see based on over 11,000 investigations that for the very high and high-risk classifications that we have a greater probability of subsequent investigations, subsequent substantiations, and subsequent investigations with removal. So then on the next slide you'll see that the impact of resources, and this was done by our Orange County research, that opening and serving cases for our low and moderate risk were statistically insignificant. So if we're looking at subsequent substantiations within 16 months from the original referral, we are going to have a much greater impact on servicing those high-risk families and the very high-risk families, as you can see delineated by the green and the gray lines here. So then we took our population, as you see in the next one here, is looking at our substantiated closed referrals by risk level. And we originally thought, gosh, this was going to be too great of a number for us to be able to provide these services. But as you see, for the calendar year of 2017, there was only 250 of these families, which is a very manageable number. And this has allowed us to be able to really strategize with how we can serve these families. And then on the next slide, you'll see that our family resource centers have had such great outcomes when working with these families. So what you're looking at here is the pre- and post-evaluations in the areas of family communication, of domestic violence, of emotional well-being, of community resource knowledge, parenting skills, and those that were connected to the local schools. And you can see how the engagement and resources at these family resource centers have very effectively moved the families from the at-risk and crisis levels to the safe and stable levels. And so that goal is to be able to now have the families to get the best benefit of these resources for the families that are at the greatest likelihood of abusing and neglecting. So in summary, going through the lessons learned, right? It's about teaching a man to fish. If there are certain things that people can get themselves, there's no need to rely on our data community to be able to do that and make sure that we can allow them to focus on the things we can only get from them to be able to have them to be the most effective. It's also important that we prioritize, right? What gets watched gets done, and we can't do everything all at once. And so giving this level of priority also allows our data teams to dig a little bit deeper into what they're doing to really help to move us to the next level in these different areas. We learned also that research needs to be the first call and not an afterthought. Anytime we're doing something new, when we're able to determine which metrics we need to capture, and having our research team in from the ground floor allows us to avoid those instances that we get 2 years into something and go, oh, gosh, it would have been great if we would have been able to have that information captured to be able to pull outcomes based on that. It's also important that we continue to do a constant evaluation on the things that we put out. When we're finding things are not valuable, it sometimes is, since it's normal and it's comfortable, that we'll see these things come out again and again. But again, that's not the most value that we're getting for our most bang for our bucks, so to speak. It's also important that our data teams immerse themselves in the process. And so because our data teams are so good and they know what we do, they many times suggest things that we hadn't thought of, and then that really helps, again, things to become a richer dialogue. And that research, of course, is an ongoing discussion. But, of course, with anything good, you also have challenges. And so because we do have this research team and everybody knows them and they're so great that they get so many different requests that this becomes important that we are vetting them. We also find that our community partners are also inundating them with the well. So we've tried to solve this by having everything run through our set team, so we're avoiding duplicative results or requests. Also, too, there are so many reports that they do create and that people want to see and that people don't want to dig for themselves. And so that, again, becomes a vetting, again, to give them what they really can at that particular time. They also need that time and experience to learn our complicated system. When somebody new comes in or if they do different rotations, it does take a lot of time for them to get up to speed with our system to be as effective as we can. Another barrier that I'm sure multiple jurisdictions have dealt with has been confidentiality. We have many opportunities and requests as we work with different partners for us to be able to blend databases with our healthcare agency or with our probation department or our court system, but there's a lot of challenges that we have with that we're continually working to overcome. Some of them can be addressed with some of the multidisciplinary team section codes, but these are barriers that continue to exist. Also, when we bring partners to the table, many times partners have their own agenda, and they're not necessarily focused on what's best for our outcomes, but what's best for their organization. And so this becomes obviously a bit of a challenge that we want to make sure that we keep everybody on the same page and that we're really focusing our teams on the outcomes, but helping our partners to also feel like they're getting something from this as well. So another challenge has been in data capture. And our current SACWIS system does not capture all of our necessary data fields, so sometimes that requires coding things special for different projects, and sometimes that actually requires us to create some different databases. And this process, if we're creating an actual database, it could take up to 2 years because there's such a demand for that in our county. And so that becomes another big challenge that we have. So we continue to try to work with those and continue to build things as we know that really this data partnership becomes critical to help us to achieve our goals in child welfare. So with that, I'm going to turn it over to our next presenters, Andrew White and Kristin Bernard.
Good afternoon. Thank you, Scott. I should say good afternoon or good morning for those of you further west. I'm Andrew White. I am Deputy Commissioner for Policy Planning and Measurement at the New York City Administration for Children's Services. Just my luck, I came down with a cold running up into this webinar, and so I may sound hoarse, but I'm fine. I want to say, similar to Orange County, we have pretty much exactly the same list of challenges as Scott just showed on that slide as far as our data team goes. So I imagine many of you between the East and West coasts can sympathize. ACS, my agency manages child protection services and juvenile justice services in New York City. We also contract with, monitor, and support a pretty large network of not-for-profit organizations who provide in-home family support services and foster care. And my division within ACS includes managing our research and analytics team, as well as policy, planning, workforce development, and performance management. Kristin?
Hi, everyone. I'm Kristin Bernard. I'm an assistant professor in the psychology department at Stony Brook University. And a third key player in our research practice partnership is Power of Two, which is a nonprofit community-based organization that is delivering home visiting services to families with infants and toddlers, both in the child welfare system as well as in high-risk communities. So next, I think Andrew will provide some background about his work as well as give an overview of the landscape of the child welfare system in New York City.
Yeah, so we're going to talk about one particular research partnership here in New York City, but first I'll give a bit of context. At ACS, we've invested heavily over the last decade in a variety of research-informed initiatives. This is true in juvenile justice as well as child welfare, and they range from therapeutic and clinical models for prevention services to kin finding and parent supports in foster care. About 5 years ago, we began to dive deeply into the research on early childhood brain development, and we set out to find interventions that would help us reduce the impact of toxic stress on infants and toddlers coming into foster care or who were at high risk of entering foster care. So in a nutshell, that led us to investing in a program called Attachment and Biobehavioral Catch-up, which is the ABC model that was developed at the University of Delaware. In all of our work, we're committed to building the agency's capacity for strong implementation and for evaluating what works and what doesn't. And similar to what Scott described in Orange County, we use scorecards with both qualitative and quantitative data to monitor and report on performance. We have implemented the Safe Measures dashboard to help everyone in the field and in our system keep better track of their work. We don't always have the resources to do all of the evaluations we would like, but partnerships with researchers like Kristin have made it possible for us to do a lot more than we would otherwise be able to do. So we're currently collaborating with a number of outside researchers to build the evidence base of ACS-supported programs and to demonstrate their impact on children and families. And we've also built infrastructure here within ACS to use this evidence to inform our decision-making as we move into new program procurements and as we think about how we're going to deal with Family First. On the next slide, I show a little bit about the background of the agency. As I said, ACS is responsible for both child welfare and juvenile justice. On the child welfare side, we conduct about 60,000 investigations every year. We provide in-home preventive family support services to about 20,000 families each year. About 15% of our investigations involve abuse, and the remainder are involving a wide array of neglect allegations. It's important to note that nearly 2 of every 5 investigations in New York is indicated. This is largely because we have a very low standard of evidence. That's what the legislature chose to do in New York. But the very large majority of these indicated cases lead to some sort of in-home support services. Nonetheless, more than 3,600 children entered foster care last year, and about 4% of our investigations result in a removal. On the next slide, it shows some change over the last 20 years. We have sharply reduced the number of removals resulting from abuse or neglect over the last 2 decades, thankfully. And this reflects a very intentional effort to focus heavily on identifying and working with families earlier and providing support services so crises don't result in removal. As charts showed, on the left side, you see the number of families or children in families receiving prevention services has gone up 221% over the last 20 years, and the number of children in 24-hour foster care has dropped from nearly 42,000 in 1996 down to 8,700 in 2017, and it is actually down below 8,500 this year. What I did not include on that chart is the number of babies that continue to come into care, and this is important for this conversation. For the last several years, ACS Child Protective Services has been bringing several hundred very young children into foster care every year. Which is exactly why we set out to work with Kristin and Power of Two to strengthen responsive parenting for moms and dads at home and for foster parents in foster homes. Kristin will tell you more about the program itself, but from our perspective, if this program is successful in prevention, fewer children will come into foster care. And if it is successful in foster care, children will experience far less toxic stress, they will go home sooner, they will not re-enter care, and they will have a greater likelihood of a positive trajectory toward adolescence and adulthood. And determining whether that is all happening or not is why we're working with Kristin.
So much of my research has focused on testing the ABC model that Andrew described, which briefly is a home visiting parent coaching program for infants and toddlers exposed to early adversity, such as involvement in the child welfare system, as well as exposure to stressors in the environment like poverty. And as we found strong evidence of ABC's effectiveness, a primary interest of mine as a researcher is really moving that science into the world, which is how I came to be really interested in partnerships with the community. At the same time, as a researcher, I'm also invested in doing new science, so testing novel outcomes of parenting interventions like ABC, as well as identifying what works for whom, with the goal of really tailoring services to best meet the needs of children and families. And one thing that I think is important to share from my perspective as a researcher, especially perhaps as a junior faculty member, is that I have a personal interest and some pressure in terms of being productive as a researcher. So being able to publish and obtain grant funding are factors that play into my motivation and interest in connecting with community partners that can help do this kind of work. On the next slide, Power of Two, like we said, is a third partner or player in our research practice partnership. And Power of Two launched in 2015 with the mission of ensuring that young children in New York City have the foundation needed to grow up with the best possible start in life. In order to target and disrupt the effects of intergenerational threats like poverty and trauma, Power of Two has really came to ABC and sought to scale that particular intervention. And a critical focus of theirs the past several years as they've launched has been finding partners in the community, both individual organizations as well as city-level partnerships that provide funding as well as support and resources that allow for that scaling up of this evidence-based model, which leads into the next slide that Andrew will talk about in terms of how we came together.
Yeah, in 2014, ACS began implementation of its 4E waiver. At that point, federal funding began to be based on our 2011 and 2012 spending patterns, and that's a time when we had more children in foster care. So this arrangement included the requirement that we experiment with new interventions and report on their impact to the federal government. At the same time, Kristin and Power of Two were partnering to launch ABC in New York City on a small scale to start, but we began conversations and we invested a modest amount of money in their liftoff as a preventive community resource for families with babies, and then we committed to investing a few $1 million over 4 years to implementing the program in our foster care system, with the plan of scaling it up to reach the large majority of infants and toddlers who come into foster care in New York City. Kristin?
Next slide. Next slide. Given that the basis of our partnership was a shared interest in scaling the ABC parent coaching program, most of our early work and discussions really focused around key issues related to successful implementation. So these include things like maintaining model fidelity as we scale up, training frontline staff at agencies to communicate with families about what the model is, and really maximizing referrals and family engagement in the program. And it was critical for multiple reasons early on to really invest in developing and designing an evaluation plan that would allow us to measure our effectiveness with ABC. So this type of data, as Scott also shared with regard to his work, is what really allows for continued planning around how to allocate resources to have the maximum impact. And Andrew described that there's a large internal staff at ACS that tracks and manages data. They also partner with Chapin Hall as an independent evaluation team of multiple of their waiver models. And my role in some of this early planning had to do with selecting appropriate measures to really study the key outcomes that are relevant for an intervention like ABC, so that our data that we're collecting over time can really be tailored to the outcomes that we think we're having an impact on with something like ABC.
So we're now in the final year of the 4E waiver in New York City, and on the implementation front, we've achieved many of the structural goals of the project. We're now serving the entire city with ABC. We're beginning to see solid evidence of effectiveness, which Kristin will describe, and we're especially pleased we've been able to maintain high fidelity in implementing the program, which did not happen by itself. I mean, through all of our implementation of all of our evidence-based models in New York City, we've built teams of staff here at ACS that are well-versed in implementation science, that work closely with the National Implementation Research Network at UNC to support this work and to monitor and we monitor and intervene with technical assistance on whatever is needed. We've also had some challenges. We're working with about 20 foster care providers in this with this program. So we have to figure out how to engineer referrals from those providers to Power of Two. We set targets, we hold them to the work, but they all have very different characteristics and very different organizational cultures, so this is always a challenge. And now we're thinking hard and planning for the future state once the 4E waiver comes to an end. And Kristin's research is especially important for answering this question. Can we prove to the financial people and to our other oversight agencies that this is worth the investment? Kristin will talk about the day-to-day operations on the next slide.
Yeah, so I think it's helpful to think about really what goes into maintaining a successful partnership like this. And a lot of it, similar to what Scott described from their team, is a lot of communication. And so this slide provides just a snapshot of some of that. There's a lot more that happens behind the scenes than this. But one thing that we have are monthly calls, which involve probably about 5 to 10 staff members from ACS, myself as a research partner, as well as about 5 staff from Power of Two, to check in about things like implementation progress, evaluation data, and any challenges that come up along the way. Power of Two and ACS also have biweekly calls with their leadership teams, and Power of Two also frequently connects with those 20+ providing agencies in the community. And this level of communication really facilitates collaborative decision-making and bidirectional reporting. For example, together with Power of Two, I provide on a quarterly basis reports to ACS about model fidelity, how all of the parent coaches are adhering to the expectations for delivering the model. ACS, as Andrew described, also provides target numbers for referrals for how they're referring children to the ABC program. And I regularly review and share model outcome data, such as the effects that we're having on foster parent sensitivity, which we code from videos. And this provides feedback regarding some of the changes that we're seeing on a family level, which again can help promote ongoing resources and support for a program like this.
So needless to say, having outside research that helps to confirm the impact of an initiative and its feasibility is invaluable. In implementation, this has helped us make sure the program is being done properly as it's originally intended. In decision-making, it's helping us decide where we go from here, and for supporting that decision to our agency leadership, to City Hall, to our budget officials, and ultimately, because of child welfare is what it is, we also have to answer to the state and the federal government. It's important to note that under the new Family First federal funding regime, evidence-based approaches will be eligible for support, so we're increasingly well-placed because of these partnerships to be able to offer our evidence and make a supportive case for several initiatives. Kristin?
And for me as a researcher, this partnership with Andrew and his team, as well as with Power of Two, has also really been invaluable to my work. It provides an infrastructure that allows me to continue doing the kind of science and research that I care about by providing access to the populations that I want to serve. On the next slide, I just wanted to share a few quotes or feedback that I received recently on a grant application submitted to the NIH, which provide examples of how this kind of partnership has strengthened my ability to get funding. So the first quote here says that the well-established connection across the investigative team, Power of Two, and New York City's ACS is a critical strength of the project. This effectiveness trial involves a strong collaboration with community partners that will ensure that the results have utility. And finally, the environment is excellent in terms of integration with child welfare and community service agencies, resources for data collection in the field, and so on. And so these quotes really highlight, for me, the benefits of establishing a strong partnership on affecting the potential or likelihood of getting funding for research. On the next slide, we'll introduce some of the challenges. And so, of course, there are great benefits to the kind of partnerships that we're describing, but there are hiccups and challenges that come along with that, sometimes due to competing priorities or pressures that are important to be aware of. On the practice side, often the primary goal is really reaching families and enhancing child well-being and support. And sometimes this goal may prevent using the most rigorous research designs, like randomized clinical trials, where that requires having a control group of families not receiving an intervention. Additionally, and I think this second point is a huge one, there's often limited funding for research. So Scott described how he did some of his work without any funding, and I think that's often the case for the type of work we're trying to do. Finally, sometimes questions of immediate interest to myself as a research partner might not align with the practice relevant questions that are of immediate interest to a practice partner. So for example, I might be interested in looking at parents' brain activity, but that's not going to help answer direct questions like what families might benefit from a short-term intervention like ABC versus a more intensive intervention that would help ACS make decisions about funding and future decision making. So finally, we'll end by sharing a few tips or lessons learned that can help build or promote a strong research practice partnership based on some of these challenges. The first is to identify shared research interests, thinking about what projects can both inform decision-making in child welfare and also advance the science in the research community. Second, what can the practice partner offer the research partner and vice versa while minimizing burden on either side? So entering into a partnership like this, it's important to think about both give and take and how we can mutually benefit one another. And then finally, being patience and flexibility goes a long way. So developing one of these collaborative and mutually beneficial relationships takes a lot of time, and some of the outputs for the practice side, like the number of families served, or for the research side, such as number of publications or grant funding, might not come quickly early on, but investing in this sort of long-term relationship can have impactful payoffs over time.
Great, thank you, Scott, Andrew, and Kristin, for providing such wonderful examples to illustrate how the research and the partnerships have really benefited both your day-to-day work as well as moved you towards the outcomes or the mission of your organization. It's very impressive. Before we move to our questions and answers, which you can enter again in the Q&A section at the bottom of your screen, I wanted to share a resource with folks. At the William T. Grant Foundation, we too are convinced that research practice partnerships are a very promising strategy for improving youth outcomes. And we have developed what we call a microsite to provide some resources to those who are thinking about stepping into this space to initiate a partnership, as well as those who already have a partnership underway and want to grow and mature. And so we've developed a website that features a range of resources, from some explanatory material about what is a partnership to how you do this work, which we heard in both of the presentations about how relationship intensive it is and the kind of social interactions or exchanges that have to happen on a regular basis to sustain them, to templates from partnerships that exist across education, justice, child welfare, and mental health on how to construct these partnership agreements, data sharing agreements, what published works or briefs might look like, how you make the case for funding with a funder, and how you go about staffing these. We have position descriptions that could help with that, different kinds of organizational structures, which we heard two of here today, one that's embedded in a child welfare agency that partners from within, and another that's external, and there are other examples as well. And then examples of how you evaluate and use the evidence, use the findings that you're getting to improve your work. And all of those can be found at the William T. Grant website as listed on the bottom of this slide. Now we're going to pause and stop speaking for a moment to take your good question and answers that are coming in. And again, you can enter these on the bottom right-hand corner where it says Q&A. So we're going to start with a couple of questions. One, since we just finished with Andrew and Kristin, some folks were asking what role the partnership played in scaling up ABC to maintain fidelity.
That's a great question, and I think there's maybe two components to that would be important to speak to. One is that the model developer, who is Mary Dozier at the University of Delaware, very clearly defined what fidelity means from the outset and put in place procedures for training and supervision and frequent feedback for the parent coaches to measure and sustain fidelity to the model. So ABC, given that it's a parent coaching program, involves having parent coaches make what are called in-the-moment comments to the parent while they're in a session. So saying something like, "That was great how you picked him up when he fell down. That's such a nice example of nurturance." And so the parent coaches get scored on a weekly basis from a randomly selected video clip on how many of these comments they make and the quality of those comments. And that's something that's built into the role for parent coaches. So there has to be time protected for them to do this sort of self-coding and for supervisors to do it. And that's a requirement of the ABC program. So in addition to having that really clearly defined and measurable, another key decision that we made in partnership with the model developer, Mary Dozier, as well as with Andrew and his team for New York City, was whether to have ABC embedded into all of these 20+ foster care agencies with staff from the agencies implementing the program, or whether to have ABC centralized at Power of Two, which is an organization that currently is just delivering ABC. And we decided on the latter in part because that really helped us protect fidelity to the model in a way that might be harder to do if it was spread out across all these different agencies. So within Power of Two, we have positions funded through the contract with ACS who are positions that monitor fidelity. So those people are trained by the model developer to do coding of fidelity and supervision related to fidelity on a weekly basis. And so having that funding and support really helped prioritize that piece of the program. I don't know if, Andrew, you have anything else to say. Andrew also has an implementation team that monitors that closely, and so that has helped support that as a priority.
Yeah, I mean, my only addition to that is that we are working with a number of evidence-based models, and there's a variety of approaches. Some of them, like ABC, have a very rigorous internal fidelity monitoring methodology. Others less so, and that means we have to do more on our end. But in either case, you can't just set these programs going and then step back. They will not, it's unlikely that a program would maintain fidelity without constant monitoring.
Mm-hmm.
Great. Thank you for that. And Scott, similar to the question we just gave Kristin and Andrew that's quite about a very specific task, there was also a question to you about whether you could tell us more about the multidisciplinary team section codes that you referenced in your slides.
Absolutely, yeah. There are a couple different sections that we've had our county council review that allows for data sharing between agencies when the purpose of a multidisciplinary team is for child abuse prevention. And so we've been able to utilize some of those when we're working with different organizations, and honestly it becomes a meeting with the different attorneys for them to all try to figure out some of the confidentiality limitations and how we can work through that. But that has provided some different guidance for us to be able to work through some of these long existing barriers.
Great. And we have a question for each of the teams. As organizations or agencies are beginning to think about partnering to better involve research, can you give some advice for those who are starting out, whether they want to build an internal research unit or strengthen it in some way, and for those who are beginning to look for external partners and how you vet them to make sure that you're getting a good partner in this work?
That's a really good question. I think that for a lot of the external partners, and for that portion of the question, I think as we develop relationships more and more and having some of these ongoing dialogues, that it allows us to kind of vet it along the way and kind of see what's happening versus just relying on them and just kind of putting that trust in. The more that we build that, we kind of see some of the things they have to offer. I think that's been very, very valuable. And then as far as the advice from my end, I think kind of what I talked about in my presentation is really working to meet together as we are prioritizing our outcome and having this communication as far as what we're going to prioritize as the key things to focus on, and then to start with one or two things, and then as you start working out some of the bugs, it allows things to be able to grow much quicker versus trying to undertake, have such a huge undertaking and then kind of overwhelming yourself if things aren't as strong as you'd like them to be.
Great. Anything you'd like to add, Andrew? Or
I would. Certainly having internal analytic capacity is critical for us. I think it makes it much easier for us to be able to work with external partners. I know some agencies don't have that capacity. We are very lucky to have a significant data team with we're pretty savvy analysts, and that helps a lot. At the same time, in terms of sort of strong partnerships, it really depends on building a context. So the contextual supports, we have to have leadership support, we have to have a well-trained staff, and we have to be committed to making sure the competencies are there for tracking what is happening and being able to have a meaningful conversation with our researchers and our program partners. So it is a real commitment in terms of vetting who we work with. Some of the models we've worked with have come to us via our providers. And nonetheless, we've gotten to know the developers very well and spend a lot of time with them. We are on calls with them at minimum once a month. Others are ones that we found and went through a pretty rigorous vetting process, looking at the research, getting to know the papers themselves that have been written about the models, and understanding the quality of the research. I think all of that is important, and if you're an agency that doesn't have that capacity, you would have to find possibly consulting support to help build it.
Great, thank you. Kristin, anything you wanted to add from either as advice as to working with the researchers or thinking about who you might select, or what your lens was as you were thinking about partners?
Yeah, certainly it was clear to me from the start that ACS was really invested in evidence-based service. So their commitment to that was really compelling to me as a researcher wanting to partner. And something that I really appreciated as the research partner was that I was really involved in initial conversations about how we can scale and maintain fidelity and what measures we should use to assess outcomes. And so having an agency like ACS really trust in the research partner and value their perspectives and opinions, I think for me made a big difference initially in making me want to invest kind of the time in this kind of partnership.
Great. I think we have time for 2 more questions before we close out. One came in related to both what Scott and Andrew mentioned about the importance of data and analytic capacity within the organizations. And folks are wondering if you do intentional training to build the capacity of other staff as well, how you went about selecting or creating these data capacity within your own organizations.
Yeah, I think this is Andrew. One of the interesting things that Scott had in his deck is the sort of challenges working within the agency and the requests that you get and the sort of the need to be vetting all these requests. A lot of this is dealt with for us by doing data trainings with people across the agency so that every one of the program areas, whether it's foster care or preventive home supports or the other divisions that we work with, making sure they have data leaders who are data savvy. Our SACWIS and other systems are so complex that they can't easily do the coding to pull data themselves, and it is time consuming. So we want to make sure they have that knowledge, and that helps in our partnerships as well. So that Kristin works pretty closely with the leader of our implementation team on the foster care side, who is not a data person but has increasingly become very capable and savvy in using that. So we use data leaders, which is a model out of New Jersey and New Mexico, to train and work and build projects in our program divisions so that people really build a sort of basic understanding of how to use data.
Yeah, we do in Orange County as well. Oh, I'm sorry, go ahead.
No, I was going to say anything you want to add, Scott. Go ahead.
Oh, yeah. No, we do a lot of different trainings as well in Orange County. A lot of that is around some of the existing data systems that we have, like Safe Measures, and, we just did a training just this week for all of our managers with their secretaries so that they actually have that ability to kind of collaborate during the training to figure out the most effective way of getting some of these reports that are duplicative. And then we had our data teams talk about or put together a handout with all of the training or all of the reports that they generally give us and where the duplication is and how people can get those reports as well. And then also, as Andrew was talking about as well, we do have leaders in the different programs as well that are much more data savvy that kind of helps us both to figure out what the needs are. And also we, like I said, use our strategic communications group for how we can market these things and get information out so that it becomes very relatable for staff too. So there are both trainings and then also the materials that we put out to them.
Great. Thank you very much. Actually, we're very close to being out of time, so we're going to move to the last slide. And thank you for the very robust conversation that we just had about the partnerships. We have pulled together a number of resources related to today's conversation, a link to the microsites that I described. If you put RPP, /RPP on the end, it will take you directly there, or the way that Kate has configured it. Also, we have the material that Scott referenced earlier in his presentation, as well as the recording and slides from the first 3 webinars in our series on leading with evidence, which, as you can see, talk about working with developers for adaptations on evidence-based programs. How do you fund these, which is particularly relevant given the implications of Family First, and assessing your readiness for implementation using a very specific tool. We are so glad that you are able to join us this afternoon. Suzanne and I are thinking ahead to how we can continue this conversation about leading with evidence. And as we said, it's a place where research is not privileged but works in tandem with your professional expertise to move in the best ways possible towards good child outcomes. Thank you very much for joining in today.